Welcome to Global Public Health Podcasts, where we learn from each other about the global and local intersections in health. Hi, I'm your host, Lauren Clark. I'm a professor of nursing at the University of Utah College of Nursing, and I'm bringing to you stories from students with insights into global health. Welcome to Global Public Health Podcasts. Today, Steve Crockett is talking to us about a topic that I like to call all that glitters is not gold. He's going to point out the irony that as a person from a high-income country, he visited a low-income country, and he's going to reflect on the irony of quality care in both of those settings. As he compares the two healthcare systems, I want you to listen for one small gem buried in his story, and that is the difference in cultural preferences of antibiotic route. So enjoy Steve's podcast.
My name is Steve Crockett. I am a third semester nursing student at the University of Utah. And I am going to share a couple stories of my experiences with international or global health, especially how it relates, I think, to me being a nursing student. One of them is kind of a personal experience that I had. My wife and I have the opportunity to travel to Mexico quite a bit. People often joke when you say that you're going to Mexico with some bias that don't drink the water, you might get sick, or make sure you don't end up in a hospital, don't eat the street food, whatever it might be. There's kind of a lot of preconceived notions that you can have traveling to a different country. Several days into the trip, I got quite sick, actually. I started to lose a lot of fluid and I started feeling faint. And I told my wife, I might benefit if I go to see the doctor. She really encouraged me to do it. She said, why don't we go? I said, yeah, I don't know. Let's play this out a little bit longer. And so we waited a couple more hours and I realized I definitely wasn't getting any better. And so I gave in. I said, okay, I think it's time. We really need to go. And so she called for her parents to drive me to a hospital. And we drove, and I was so sick I don't remember a ton of the details about it. I just remember feeling really weak. I remember entering this hospital. And one thing that really struck me about this was that there wasn't a huge waiting room full of people. It was actually a fairly empty room, and it was really clean. And the person who gathered our information told us that we would be helped soon. And soon, I wasn't sure exactly what time frame that meant, but based on this experience, it was actually very quick. Within a few minutes, I was brought back to an ER room where I was placed on an exam table, given a blanket, and told that the provider would be seeing me shortly. I thought the provider would actually be coming to visit me, but it actually flipped. I was required to go into an office where I sat down, not with a nurse, but with a doctor who sat across from me at a table. And while sitting at the table and typing into a computer, essentially wrote my triage note. Asked me some basic questions about how I got sick, what my symptoms were. I did my best to answer them. My father-in-law was helping me because there was some lost in translation moments as well. And she said, okay, we'll get you feeling better. We'll take you back to your room. And so I was brought back to my room. And immediately after I enter that room, a nurse is already there with a primed IV bag and with a needle to stick me. And she does that, and I start to get hydrated. And as that dripped in, I started to regain a little bit of strength. The IV bag finished. The nurse came and asked me how I was feeling. And I said, I don't know. I haven't gotten up to walk yet, but I'm feeling maybe a little bit better. She goes, let's get up and walk to see how you do. So I got up and walked, and I had actually quite a bit of strength that had returned. And she said, I think you're ready to go home. And I thought, wow, that was quite fast. That was just over an hour, and I was seen by a doctor. I was seen by a nurse. I had medication that was given to me. And my natural question was, well, what do I do to follow up in case I am sick and it's just IV fluid and this medication that's in me? What happens when this wears off? She said, well, we'll give you a prescription. And so she gave me a prescription, and I left the hospital feeling significantly better. And I was surprised when I went to the pharmacy and handed them the prescription that the pharmacist turned around and looked at a few different boxes and handed me a box, and he says, "This is the medication that's been prescribed to you." And I look at it as an antibiotic, and there are 3 different syringes in there and a vial in which I'm assuming that someone is going to inject me. And I said, "Well, what am I supposed to do with this?" And he said, "This is your medication. Go home, you inject this yourself." And that was quite a big difference than what I think I've been accustomed to seeing in a country like the US, where if you were to have follow-up antibiotics, most of the time I think it might be an oral antibiotic. If it's an injection, you would have perhaps a nurse who would do it. But definitely, I was thrown off by the belief that I was supposed to inject myself. By the time that we caught our flight to return back to the US, I was significantly better. In fact, I would say, other than the fact that I may have felt just a little weak, I didn't feel sick at all. And I've thought a lot about that experience since it happened, mainly because the notion that I had going into it was to do everything I could to place myself in a vulnerable situation in a country outside my own, in a place where I had been warned to, avoid specific foods, water, and especially the hospital. And in this case, I didn't feel like any of that was warranted. I feel that the care that I received in this hospital was great. I was seen quickly. I visited with the doctor. I received medication, and I received proper follow-up. And I look back on this experience and think, when we go down and visit again, if I happen to get sick, I really have no hesitation of returning to a hospital. I had a good experience. And throughout this semester as a nursing student, I've had this personal situation kind of flipped from being in the viewpoint of a patient to suddenly being on the opposite side of one who provides care, and that being a student nurse. And throughout the course of the semester, I had the chance to work at a community clinic. This community clinic is 100% volunteer. It has various specialists and different disciplines within a health team. It is called the Hope Clinic. It's located in Salt Lake City. And it is jam-packed full of people. On a given day that it's open, there are roughly 120 visitors to this clinic. And there are typically anywhere between 2 to 4 providers, whether that be a physician or physician assistant or a nurse practitioner. The irony, I feel, of the situation at the Hope Clinic is that, like how I was a foreigner in a country outside my own and didn't know exactly what to expect in terms of healthcare when I had to receive it, so are a lot of the people who show up to the Hope Clinic. It acts kind of as a safety net for those who are uninsured or those who are traveling or those who are refugees. In particular, I remember there was an event with a patient who had come to the Hope Clinic for repeated UTIs. He was diagnosed just a few weeks before with kidney stones, given some antibiotics, and asked to follow up if his symptoms persisted, in which they did. He showed up to the clinic a few weeks later and said that he was still experiencing severe pain upon urinating. He presented essentially with the classic symptoms of a UTI, which were thought to also be caused from the kidney stones that he was diagnosed with just a few weeks earlier. And so the health team evaluated him again. The doctor thought, with having given you the antibiotic, having given this some time to perhaps remedy itself of the situation, the thing that would ultimately be best is that if you were to receive follow-up care from a specialist, that specialist being a urologist. Responded by saying, "That's great, but I'm from Venezuela. I'm planning to return home in just a little over a week. I'm here on a tourist visa, and it's about to expire. I can't remain in the country for 2 months. And in addition to that, the health system is in complete turmoil right now. You can't even go to a pharmacy and find any medication on the shelves. You can't even go to a grocery store and be able to find something like bread readily available. So how am I supposed to return to my country without a confirmed diagnosis as to what continues to cause my kidney infections and my UTIs? Which I thought was a great question. And as a nursing student, I thought, gee, I want to advocate for this patient. I want to do everything that I can to help him out. But what can I do? The issue is that we need to possibly restructure our system as we know it. If we were to continue to pop up these clinics and help the most vulnerable populations, the argument could be made that everyone is being covered, everyone is receiving the help that they need. But as was demonstrated with the example at the Hope Clinic, is that really helping someone to the greatest extent that we can? Diagnosing someone with a condition, but not being able to have the proper follow-up.
After listening to Steve's podcast, do you sometimes ask yourself a question, like I do? Maybe a question about global health and why is it so confusing? How can we, as lifelong learners, prepare ourselves for the challenges in our own healthcare system, as well as prepare ourselves to go into other healthcare systems and learn about what works there and how we might be able to share ideas and make every system better? Thanks to Steve for sharing with us the irony of healthcare in a global and local environment. Thanks for tuning in to the Global Health Podcasts, where we learn from each other about the global-local intersections in health. I'm Lauren Clark. Thanks for joining us.